I'm Dr. Shannon Crow.
And I'm Dr. Brian Blonder from Sugarland Hormones and Wellness and Sweetwater OBGYN.
Welcome to our very first virtual webinar. Tonight we're going to be talking about bioidentical hormone pellet therapy with BioTE. We will have, in the next 10 minutes, have a presentation you can watch, but stick around because at the end we'll be able to answer questions live. If you look on your chat tab on your computer, you can ask questions, and we will follow up as many as we can at the end of the presentation. In addition, all registrants will be entered into a drawing for a free laser genesis, which is a Hollywood facial, which is a zero downtime laser that we have here in the office and love, and that's a $300 value.
We'll also be offering a $25 discount for all new female pellet patients and a $50 discount for all new male pellet patients. That will be good through the end of November.
Tonight we're going to be talking about bioidentical hormone replacement, specifically with BioTE hormone pellets. And what does all that mean? Hormone replacement basically refers to replacing some of the hormones we lose as we age. And bioidentical essentially means the exact same molecule our body makes. So for women, we make estrogen, we make progesterone, and we make testosterone. Actually, we make more testosterone than estrogen during our lifetime. And for men, they make testosterone, and some of that gets converted to estrogen. And so when we talk about optimizing your hormones, we're trying to replace some of those hormones that we have lost through either surgery or age or other factors.
Let's talk about what causes low hormone levels in men and women. First and foremost, we think of age. Women produce hormones called testosterone, estrogen, and progesterone. And believe it or not, women predominantly produce testosterone. Women start losing testosterone in their 20s and up to 50% into their 30s. Men start losing testosterone in their mid-40s. Secondly, we think about sleep. Poor sleeping habits cause a lot of hormone imbalances and symptoms. We also think about diet, poor diet, excessive exercise, and stress. And everybody has a little bit of stress in their life. And last and not least, medical conditions such as diabetes, thyroid disease, and other endocrine problems that can cause hormone imbalances. So how do we get started for treating low hormone levels in men and women? Well, for men and women both, they'll first come in for an initial consultation. For women, we'll check an extensive hormone lab panel, including thyroid panel. Women will also be required to have an annual pap smear and an annual mammogram after the age of 40. For women, we also like to get a baseline ultrasound if they've not had a hysterectomy in their past medical history. For men, we like to check an extensive hormone panel as well, including a PSA, which is a prostate-specific antigen. This should be checked every year from the time they're on their hormones going forward.
So what are the different forms of delivery of hormones? First of all, let's talk about pills, the thing you should not do. So oral estrogen or a pill form of estrogen or testosterone is not considered safe. And the reason is it is metabolized in your liver, which increases clotting factors and could lead to an increased risk of stroke or cardiovascular events. And nobody wants that. And so the way to get around that is to deliver those two hormones specifically. Progesterone is safe in an oral form, but estrogen and testosterone you only want to do if it's subcutaneous or transdermal. So transdermal would be things like creams and patches, but we have found that the delivery is a little inconsistent. Some people have allergies to adhesives, but for some people that works out fine. What we have found that works the best in our practice are the BioTE pellets. And the reason is that they are inserted directly into the subcutaneous tissue. So there's a very consistent and predictable absorption of the hormone over a prolonged period of time. And this is according to your own cardiac output. So it is very customized to you. So is there any downtime after a pellet insertion? Not much. For women, we just ask that you don't soak in water like a hot tub or a bath or a pool for 3 days, and you don't engage your glute muscles for 3 days. Upper body training, walking, all that is fine. For men, it's a little bit bigger procedure, so we ask that you refrain from heavy glute exercises if it's inserted in the glute for 7 days. And the same thing with water. Showering is fine, but no bath or hot tub for 7 days. As far as when do the pellets kick in, estrogen generally will kick in about 3 days, and testosterone starts kicking in about 7 days. We see the peak of the activity about 4 weeks for men and 6 to 8 weeks for women. And so that's when we like to check your labs to see how you're absorbing. And then we also like to see you back to see how you're doing. How long do the pellets last? For women, they generally last anywhere from 3 to 5 months. And for men, anywhere from 5 to 6 months.
Hi, my name is Sharon Hyatt. As you can see, I'm a Pilates instructor, and I live right here in Sugar Land, Texas. I'm 61 years old, and I'm doing this video because I really like to talk about how the BioTE hormone replacement therapy has helped me and my husband in our lives and in general these past few years. I've been doing BioTE with Dr. Crow for the past 3 years, my husband for the past 2 years. And I have to tell you guys, there's a lot of misinformation out there. And I know a lot of people think that hormone replacement therapies aren't safe. So I really encourage you to get the facts and not just listen to what you've been told through the years. There's no reason why you shouldn't feel great in your body at every age. And what BioTE has done for me and my husband is it's helped us regain that feeling in our body of energy and vitality. You know, when you go through menopause and andropause as a male, things just start to plummet. You know, your libido drops. We all know how that goes. Suddenly you're thinking, is this all there is for the rest of my life? It could be another 30 years. No, there isn't. There's a way to fix all that, and it's with evening out the hormones. You have to go to the right doctor. You have to go to the right place. You have to go and do therapy that works for you. And this one really works. It's just a couple of little pellets that get inserted on the backside. It's fairly painless, just a little tiny little puncture. And for women, they can last up to 3 months, for men, 6 months. And I just really encourage you to at least make an appointment. And if you're at all curious, go talk to one of the doctors. They know what they're talking about. There's a lot of research behind it. And look, I'm living proof. It's awesome.
Thanks everyone for attending our live event this evening. I'm Louise Lannon, the practice manager here at Sweetwater OB-GYN and Sugar Land Hormones and Wellness. I'm also a BioTE patient for the past 7 years, my husband as well. We look forward to all of your great questions this evening, and hopefully we can provide you with a lot of feedback that can help you make a decision about this life-altering treatment, which truly is amazing. Remember that we have our free giveaway for Laser Genesis, also known as the Hollywood Facial. We love this treatment. And also we will do $25 off initial pelleting for female patients and $50 off initial pelleting for male patients. Please keep your questions coming for about 15 to 20 minutes while we are live. We'd love to answer all of those for you as best we can. And expect a message or a text if you are interested in a consultation. Just let us know and we'll reach out to you and get that scheduled for you. And as always, if you need to email or call us, you can easily find our email and phone number on the website at sweetwaterobgyn.com. Thank you so much. Have a great evening.